Over the past decade in Australia, there has been a 20% increase in the number of suicides. And suicide is the leading cause of death for Australians aged 15 to 44. Suicide rates of Aboriginal and Torres Strait Islander people are at least twice that of non-Indigenous Australians. And while women make more suicide attempts, 75% of suicides are by men. It's clear the suicide rates aren't lowering, and we need a new approach. Despite strong community will for action, often suicide prevention efforts are uncoordinated and not based on good evidence of what works, leaving us with a system where people often fall through the gaps. LifeSpan has the potential to turn this around. LifeSpan is a new, evidence-based approach to integrated suicide prevention. It combines 9 strategies that have each been tested and shown to reduce suicidal behaviour into one community-led approach involving health, education, frontline services, business and the community. LifeSpan aims to build a safety net across the community by connecting and coordinating trained people, effective programs, and improving the system of support for people facing a suicide crisis. LifeSpan has 6 essential ingredients: community engagement, local ownership and adaptation, data-driven decision-making, workforce information and development, lived experience inclusion at every level, and local cultural governance and inclusion. We work closely with the Indigenous communities and strongly support the Gaia Dewey Proud Spirit Declaration and the right of Aboriginal and Torres Strait Islander people to design and lead their own solutions. So how does LifeSpan work? Let's take a look at how it will support a young person, for example. When LifeSpan is implemented, a young person will have increased resilience from proven education programs delivered at their school. If they show signs of distress, training provided to people in the community will increase the likelihood someone notices the warning signs and supports them to seek help. When they visit the doctor, universal screening will help GPs pick up on vulnerability, and if they need specialist help, it will ensure they can find a trained provider. If they need emergency care, police, paramedics and hospital staff will better understand how to manage the crisis, and they will receive coordinated follow-up care that includes their family, school, GP and specialist, so they can recover. Messages in the local media will focus on stories of recovery and how to get help. The community will be involved in local activities to drive change, and access to the means of suicide will be reduced wherever possible to keep people safe. In this way, LifeSpan connects up different parts of the community to create a safety net that improves outcomes at every turn. Let's take a look at what each of the 9 LifeSpan strategies involve. A suicide attempt is the strongest risk factor for subsequent suicide, so it makes sense to provide the best care possible to people who are in crisis. To help ensure people in crisis get better care, LifeSpan is working with hospital staff to implement new training and guidelines, providing resources to families, and putting in place a dedicated aftercare support service to deliver person-centred follow-up care. There is evidence that collaborative care delivered with empathy and skill is effective in helping people who are feeling suicidal, and that treatment should be tailored to each person's needs. That's why LifeSpan is supporting mental health professionals to provide quality care by delivering training, sharing information on treatment options, and encouraging the use of e-health programs to increase the use of evidence-based treatments. People generally visit their doctor in the 12 months before a suicide attempt, but often they may not tell their GP about their suicidal thoughts. And if they do, not all doctors specialise in mental health or suicide prevention. LifeSpan supports GPs to assist people at risk by delivering advanced training in suicide prevention, more resources, and improving local referral networks. LifeSpan also introduces new technology that GPs can use to screen patients for depression, anxiety and suicidality, and creating opportunities for people to tell their doctor how they are feeling. We believe this will help identify more vulnerable people who might not otherwise reach out for help. Frontline workers such as police, paramedics and mental health workers are well placed to assist someone who is suicidal and play a key role in influencing them to get help. These first responders are also exposed to stressful situations and trauma in their work and can become vulnerable themselves. That's why LifeSpan involves frontline workers in local efforts and provides them with evidence-based training to help them support the community and their colleagues. Young people can be particularly vulnerable to mental health problems, self-harm or suicide, and schools are a good way to teach them new skills. LifeSpan is implementing the Youth Aware of Mental Health or YAM program, which has shown strong results in reducing the likelihood of suicide and is flexible enough to reflect the diverse needs of different young people. It works by teaching young people about mental health, coping skills, and how to get help early. LifeSpan will also train and connect teachers, parents, and school psychologists in suicide prevention. Many people who have suicidal thoughts do communicate their distress, but the warning signs may be missed or misinterpreted. LifeSpan will train people in the community to dispel myths, identify early warning signs, start a conversation with someone who may be at risk, and connect them with help. By delivering programs with strong evidence for building these skills and increasing networks of people trained in the community, we can strengthen the local safety net. Targeted campaigns and activities can be an important first step for many people to increase their awareness of local suicide prevention services. Community campaigns may also encourage people to take the next step and undertake training to be able to help others. Community-led campaign activities will be designed to reinforce the other LifeSpan strategies and encourage people to get involved. Responsible reporting of suicide is important in reducing suicide rates and improving awareness about how to get help. That's why LifeSpan supports local media and mental health organisations to undertake mindframe training. LifeSpan also supports communities to develop their own response plan for critical events and provides training to people with lived experience to share their story in a safe and appropriate way. Our goal is more media coverage of the issues that need to be fixed, making sure that the voices of people with lived experience are heard and that messages are safe and focused on the solutions. Local suicide trends are not well understood, and there is a lack of timely data to inform prevention efforts. Restricting access to methods of suicide is one of the most effective prevention strategies, particularly when coupled with the promotion of support services and help seeking. By using data to identify trends and working together to keep people safe, communities can develop a long-term plan to reduce suicides. We all have a role to play, including looking after ourselves and supporting each other, but it is only by working together that we can prevent suicide. There are many ways that you can contribute, including by doing suicide prevention training and learning about the services and supports in your community, so you can help yourself and others. To find out how you can make a difference, please contact your local primary health network or visit www.lifespan.org.au for more information.